Hello everyone. We will discuss the methods to prepare the museum specimens. Preparation of the museum specimens. Many surgeons must have been disappointed at the contrast between the preserved specimen and its appearance when freshly removed in the operating theatre. Most of the failures and disappointments could be avoided if there were a better understanding of the simple technical processes that are involved. Mistakes made in the early stages can seldom be corrected. Preliminary trimming as soon as possible after removal from the body. A specimen should be trimmed of all extraneous tissue and dissected or sectioned to show the pathological features clearly, preferably in one plane, since a flat surface makes for ease of final mounting for display. There is one exception to this rule, namely the hollow organs such as the bladder and the gut. These should be lightly distended with fixative solution and allowed to harden before being cut. Stuffing with wool should be avoided except in the case of the heart, which is not appreciably distorted thereby. The wool should be soaked in fixative solution before being used as stuffing. When the specimen comprises hard and soft tissues, as in limbs or isolated bones, it should be frozen solid before trimming. This produces a uniform hard structure which may be cut cleanly with a saw. Quick freezing is best carried out in an insulated vessel containing alcohol and solid CO2, also known as dry ice, or in a deep freeze machine. A power driven bandsaw is a useful adjunct. After cutting, the frozen specimen is immersed in fixative solution and allowed to thaw. Fixation. The trimmed specimen should be placed in fixative solution without delay. A wide-mouthed covered vessel containing a volume of fluid at least 5 times that of the specimen should be used, and in many cases it is preferable to suspend the specimen clear of the bottom of the jar. 10% formal saline is a satisfactory routine fixative, but the addition of potassium salts, as in the Pick Judah methods, tend to promote better color restoration, especially when prolonged fixation is unavoidable. The time allowed for fixation is important if color restoration is required, and care should be taken to avoid prolonged fixation. Some tissues, such as intestines, are fully fixed in less than 48 hours, but no specimen should remain in formalin for longer than a week, with the possible exception of those containing a large amount of fat. When dealing with whole solid organs or very thick slabs, it should be remembered that the formalin will not penetrate more than half an inch from the surface, however long the tissue remains in the solution. Penetration may be improved in suitable cases, such as whole limbs, by perfusion of the vessels with fixative solution, or by spot injection with a syringe and needle. The spleen is best fixed by injection of the main vessels of the fresh specimen and like ligaturing under slight tension before the blood has been expressed by the natural contraction of the organ. In view of this limited penetration, specimen should not be cut after fixation, although it is permissible to freshen surfaces by removing a thin slice before fixation is completed. Color restoration. The fixed specimen is now transferred to a jar containing industrial methylated spirit until the color is fully restored. The alcohol penetrates the tissue rapidly and will require one change when treating large specimens in order to counteract the dilution. If the specimen floats, it should be lightly covered with surgical gauze and the vessel closed to prevent evaporation. Color restoration is usually complete from 2 to 8 hours depending on the size and character of the specimen. The temporary mount. The specimen is transferred direct from the spirit to the final mounting solution contained in a suitably sized jar and hermetically sealed. Specimens thus sealed in individual temporary mounts can be safely stored until time is available to complete the display preparation. The common practice of using large open tanks for temporary storage is the cause of many failures due to loss of color, compression and contamination by the molds. Whilst in the temporary mount, A specimen sheds most of the loose particles and soluble pigments so that when it is transferred to the display jar, the fresh mounting fluid will remain clear for a long time. The value of the temporary mount as a routine procedure cannot be overemphasized. Final mounting. Since glass museum jars are no longer readily obtainable, perspex jars are now generally used. This material has proved to be quite satisfactory with the solutions in use. Perspex, being slightly flexible, allows the jar to be completely filled with fluid, thus eliminating the air bubble necessary with glass jars and provide a more stable and transportable preparation. If necessary, the fresh specimen should be washed free from excess blood and secretion before fixation. The practice of prolonged washing in running water after fixation or washing at any other stage of the process is harmful and may promote growth of the molds. The presence of molds cannot be excluded, but their growth is inhibited by the alkalinity of the final solution. If clean, well-covered vessels are used and the specimens are taken through to the stage of the temporary mount LW Proger and sealed without delay, molds should not present any difficulty. Camphor is added to the final solution with the object of inhibiting mold growth, but its clarifying action is perhaps more important. Photography of the fresh specimen is usually incompatible with the production of a good permanent preparation. Photographers require the specimen to be placed in normal saline in order to maintain the fresh coloration and to prevent drying. The rapid autolysis of tissues during an hour or so of this treatment renders most specimens unsuitable for the subsequent histological examination as well as spoiling them for permanent preservation. Now coming to transportation of the specimens. To obtain the best final results, the specimen should be treated on the spot with the least possible delay. It is often required to send a specimen to a distant laboratory with the necessary equipment for completing the preparation. In this case, the preliminary trimming and fixation must be carried out before the dispatch. The fixed specimen, drained of excess fixative solution, is wrapped in a damp cloth enclosed in jaconate, covered with absorbent wool to trap any expressed liquid, and made up into a postal packet. For long journeys in a tropical climate, the packet should be sealed in an airtight tin box. Finished specimens may be sent in a similar way but should be wrapped in a cloth moistened with final mounting fluid. On no account must the surface of a specimen be allowed to become dry at any stage in the process. Fixing solutions: 10% normal saline, formalin 10 cc, sodium chloride 9 grams, distilled water made up to 100 cc. Juda: potassium acetate 42.5 grams, potassium nitrate 22.5 grams, distilled water 1800 cc and formalin 200 cc. Mounting solutions: pig Juda Dox modification, sodium acetate 2700 grams, distilled water 9000 cc, glycerin 5400 cc, camphor 50 grams in 200 cc. Methylated spirit. Dissolve the acetate in water, add the glycerin and then slowly add the camphor solution, stirring continuously. The bulk of the camphor precipitate is absorbed on standing. The remainder rises to the surfaces, thereby clarifying the solution. Filter and store in stoppered bottles. Sealing compound bitumen asphalt 4 parts by weight. Semi-fixed and applied hot. Gutta perch 5 parts by weight. This makes a flexible compound for sealing glass lids on glass jars and is very convenient for closing temporary mounts.